Let's now learn the technique step by step. It's now time to move on to the blood collection, and your whole material is prepared. First, prepare the bandage and stick it on the dominant hand. Open the cover of the bandage and fold one of the lateral side on 1 or 2 millimeters to help you remove the bandage easier at the end of the procedure. Then stick it on the dominant hand. Place the tourniquet above the elbow. The distance has no impact as long as the venipuncture area is accessible. Tighten strong. Remember that you want the vein the bigger possible. If your patient have long sleeves, no worries, the tourniquet can be placed above the cloth. Just tight a bit stronger. Then apply alcohol and tap on the skin to increase the temperature and increase the vein volume. Then palpate inside the M design to find the best vein. Where to perform the venipuncture? You have to know that we use 2 cm long needles, and obviously the whole needle must stay inside the vein lumen. So the needle must be introduced inside a 2 cm cylinder. This way you can safely introduce the whole needle inside the vein without risking to prick it. Obviously, if the vein is non-linear, you may risk to go out of the vein and fail the phlebotomy. Where to insert the needle? I told you we need to have a 2 cm cylinder. So we should insert the needle at the beginning of the cylinder. This way, the needle fully stays inside the vein. Here, for example, if we choose this cylinder, we should prick at the beginning of it. This way, the needle stays inside the vein. Another linear segment, the same, we prick at the beginning of this linear segment. On this example, we can choose this cylinder and prick at the beginning of it. Or we could choose this cylinder or even this one. Remember that you need a straight segment of the vein of at least 2 cm. Here is the video. You choose the segment you want and you prick at the beginning of it. Another example, yes, on the end, but still, we see that here the vein is curvy. We don't have a straight segment. But if you change the axis, you can still find a cylinder of 2 cm. I told you when you have the choice between the cephalic and the basilic, always choose the cephalic, which is bigger. Here we have 2 available cylinders and we prick at the beginning of the cylinder of the cephalic vein, the external vein. Can we get help from a guide? Nowadays in dentistry, everything can be guided from endo to bone grafts. And it's the same for the phlebotomy. Since few years now, with Joseph Choukroun, we introduced the vein guide to help dental surgeons to perform easily phlebotomies. To place the vein guide, you need a pen, and you will draw one point for the entry of the needle, the puncture point, and the second one that materializes the end of the cylinder of 2 centimeters. You can place one or several points. The more points you will draw, the more precise idea you will get of the vein. The vein guide really simplifies the venous access for us dental surgeons. You need to prick the first point and aim for the second one. It's really easy. You prick the first point and you aim for the second one. And now, phlebotomy becomes a child's play. How to draw a good vein guide? You need to place good points. For the first point, you need to palpate the top of the vein and place a point with your pen. Then follow downwards the path of the vein to place one or several other points. And to have a precise guide, we need to have a thin and precise drawing. Pay attention to the angle of your pen while you draw the points. The thinner the points will be, the more precise your vein guide will be. See, this is how we draw the vein guide. We put points exactly where we feel the vein. And as the finger guides the pen, the finger should not move off the skin because you will use impressibility. Another example, we put points exactly where we feel the vein and the finger does not move off the skin. At the beginning, don't hesitate to systematically use the vein guide, even for easy cases. This way, you will be sure to succeed in all your first phlebotomies. And you're also training yourself to properly draw the vein guide. Don't be afraid to use the vein guide in front of your patient. Just explain them that this guide avoids failures. And I assure you, patients will always prefer some pen-drawn points on the arm than a fade blood drawing. Then, with time, you will be more and more comfortable and you will use less and less the vein guide. But, in case of difficulties, you will be able to use the vein guide again to succeed. Here, for example, this was during one of our courses. The trainee drew a lot of points, but here we can appreciate the whole anatomy of the area. And it can be useful. Here, with the points, we see that the vein is actually doing a bayonet. And if your needle ends here, you will have no blood because here there is no vein. You can use the vein light to help you to confirm your vein guide precision. See, we are checking that the points are on top of the vein. Another example, my points are well drawn, they are just above my vein. You can do the opposite and place the vein guide with the vein light. With one hand you hold the vein light, with the other you draw your point on the vein. Then remove the needle plastic protection. Hold the needle by the wings and remove the cap by a rotation movement. Then hold the blood collector with the dominant hand, not at 19 degrees, but at 120 degrees. This is the ideal angulation. Indeed, with angulating the needle at 120 degrees, you will after have the good angle for the needle penetration, which is 15 degrees. Pull the skin at about 10 cm of the puncture point. This way, you will reduce the skin thickness. Many interests. The first one is that if your vein is mobile, if your vein is moving, it will be blocked by the skin, and thus the vein will not roll anymore. The needle penetration will be easier and thus faster, and the discomfort felt by the patient will be reduced. Be careful to don't move the vein and your guide when you pull the skin. Pull the skin in the axis of the vein. Then prick, and your needle is at 15 degrees with your skin. I told you the bevel is facing above, is facing you, and you need to have a fast movement. Indeed, if you're confident and you go fast, your patient will basically feel nothing. But if you're going slowly, millimeters by millimeters, your patient will feel every millimeters on the way. Just be confident and fast. Then, once you're inside the vein, horizontalize the needle to follow its path. I told you the introduction angle of the needle is about 15 degrees. Don't be too superficial because you will stay between the skin and the vein. On the contrary, don't go too deep and don't be too vertical. You may risk to prick the vein on the other side. As dentists, we are used to fulcrum in our daily practice. But in phlebotomy, we have to forget these habits. Indeed, if you use fulcrum and have your finger open, you will have a wrong insertion angle. See, the angle is too wide, too open. We need to fold the fingers. This way you can stabilize your hand on the patient's arm and have the right angle, which is 15 degrees. This way, with the finger folded, you can support yourself on the patient's arm. And also have the good angle, always 15 degrees. Once you're inside the vein, you have an immediate blood backflow. Open your fingers to appreciate it. Here, see, we prick, we open the finger so we can see the blood backflow. Another example. Open the finger to check on what you're doing. If you have the blood backflow, you are inside the vein. Another example, always open the finger to check. If you have blood backflow, you are inside the vein. You can move on to the next step. And the next step is to stick the bandage. This way, we immobilize the needle and it cannot move anymore. How to stick the bandage? It actually depends on the needle position. if the needle is fully inside the skin. In order to protect the puncture point and to immobilize the wings of the butterfly needle, we need to stick the bandage straight. If your needle isn't fully inside the skin, always to cover the puncture point and fix the wings, we need to apply the bandage angulated. Then connect the tubes in the tube holder. And remember, we want the fast filling of the tube, meaning we don't remove the tourniquet in the PRF phlebotomy. Maintain tightly the tube inside the tube holder like this. Remember that the tubes are filled because of the vacuum, meaning the filling automatically stops when the vacuum is fully consumed. The blood can now overflow. I think that now you know that the filling has to be the fastest possible, between 10 to 15 seconds maximum. You don't want the blood to start clotting inside the tube. Should we shake the tubes? Remember, we have fully empty tubes. There is nothing to mix. It's just a waste of time and it doesn't slow the clotting, meaning there is no interest in this technique. Now that the blood drawing is over, what is the first action? The first step when you finished with the tube filling is to remove the tourniquet. Remember, the veins are under pressure. If you withdraw the needle first, you may have a small hemorrhagic incident. Without gravity, but it can be quite impressive. So, we remove first the tourniquets. Then we can withdraw the needle. To do so, slightly pull off the bandage to unstick the wings. Then place your finger above the bandage, but without pressing. Remember that the needle is still inside, you don't want to press on it. Quickly withdraw the needle and press on the skin for the hemostasis. See, I'm pressing on the skin only when the needle is out. Then ask the patient to fold the arm for 1 or 2 minutes. Retract the needle to avoid any blood exposure incident. To do so, hold the needle by one of its wings and, depending on the system, either press on the buttons and withdraw the plastic protection, or in this other system, just hold back the wings so you can retract the needle. Immediately throw it in the accurate bin. Indeed, as now retracted, the needle isn't pricking anymore, it can be thrown away either in a plastic yellow bag or in a yellow container. For the tubes, as they can break, throw them in a hard yellow container. Another tip: if you've rolled up the sleeves of your patient, remember to load them down after the venipuncture, as they can act as the tourniquet and cause a small hematoma. Let's see now the tricky situation you can encounter during phlebotomy and how to handle them. We will see strong arms, darker skin, curvy or short vein, and finally, when the tube doesn't fill. It's not necessarily arm from obese patient. It could be muscular patient with a thick skin and a bit of fat just under. Those cases are for me the most challenging because the veins are not visible and they are quite deep under the skin and the fat. To find those veins, you need to make them as big as possible, meaning you need a tightened tourniquet, you need alcohol, and to tap on the skin to increase at maximum the vein volume, fold a bit the patient's arm to palpate deeply and use the vein guide. Let's see in this video. The patient has a folded arm. The tourniquet is quite tightened. And we put the vein guide. This way we have a visual marker of the vein. It's the same with darker skin, as you don't have a lot of contrast between the vein and the skin. So you need to tie the tourniquet, apply alcohol, and draw a good vein guide. See, with the vein guide, you have a visual marker of the vein position. It's not difficult anymore. Let's see now the curvy or the short vein. Sometimes you have either a curve in the vein path or the vein is short, meaning it goes out of the muscle and quickly goes back inside, and is accessible only on a few millimeters. In this case, we don't have a straight linear vein, but we have a curve with two short segments. Here, if we use the small segment, we may risk to go out of the vein. Don't think you can hold the needle in a particular position. It's theoretical. In reality, you cannot do it. In those cases, we need to enter the needle inside the skin a few millimeters before. Like this, at the end of the 2 centimeters, we have the bevel still inside the vein. Let's see on the other segment. We penetrate the skin a bit before. This way, at the end of the 2 centimeters, we are still inside the vein lumen. Let's see the video of this case. See, we anticipate, we prick a few millimeters before, and we have the blood backflow. We are inside the vein. Let's now see the situation where the tube doesn't fill. First, it's maybe because the needle is not inside the tube lumen. If you connect the tube and the filling doesn't start, it's never a vacuum problem. In 100% of the cases, the needle is too short and the needle is stuck in the cap silicone. It's often the case with collector from the brand BD, frequently used by nurses, but they have short needles. Only processed for PRF blood collectors are guaranteed to have a long enough needle. The needle could also not be inside the vein. Either you're not in a good axis or you went too deep and you went out of the vein. In those cases, leave the tube connected and without getting off the skin, remember that the patient still has the tourniquet, slowly withdraw the needle on a few millimeters and correct the axis if needed. See here in this video, this was during one of our courses, we see that the needle is not following the vein guide. We slowly withdraw it, we correct the axis, we had the blood coming inside the tube. The fact that you leave the tube connected gives you an instant feedback of what you're doing. If you have blood, it means that you are inside the vein. Don't move anymore and stick your bandage. The bevel could also be in contact with the vein wall. Indeed, sometimes with the vacuum, the bevel sticks to the vein wall and the blood cannot come inside anymore. In those situations, we just need to separate the bevel from the vein wall and we just need to pull the skin. See this example, we connect the tube, we have only one drop, but if we pull the skin, we have instantly the blood coming inside the tube. Another example, you always have 1 or 2 drops of blood, but when you pull the skin, the blood immediately comes inside the tube. Actually, those cases are not rare. It happens in about 30% of the cases. Another example, we connect the tube, we have nothing. Sometimes you need to look for the right axis of the vein and immediately the blood is coming back again. In some patients, when you drop the skin, the feeling will stop. In those cases, in those patients, you will need to stay pulled on the skin for the whole procedure. And the last example, see, the tube fills itself as soon as you're pulling on the skin. And finally, sometimes the tube doesn't fill completely because it is expired. You need to check on the date because if the vacuum is expired, the tube will only fill to the level of the vacuum and will not fill completely if the vacuum is consumed. Let's finish this chapter with the contraindication of the phlebotomy. There are relative and absolute contraindications. Here are the absolute contraindications. They are quite rare, but we need to know them. First is the arteriovenous fistula of patients with renal failure. You know, these patients, they have dialysis session and a fistula have been made to ease the access of the vein for the dialysis. Please do not touch this fistula under any circumstances. Leave it to the doctors and choose another vein. Also, if you notice any dermatopathology in the puncture area, such as burn, plaques, signs of mycosis or infection, do not insert a needle inside the skin. You may risk to facilitate the penetration of pathogen inside the circulation. About the relative contraindication, it's almost female patients that had radiotherapy after a mastectomy. Indeed, the radiotherapy disturbs the lymphatic drainage. And in case of injection or long time infusion, there is a risk of lymphangitis or venous thrombus. So, in those patients, if you have the choice, go on the other arm. But if the other arm is really difficult, you can still do phlebotomy on the arm on the side of the mastectomy. Because the phlebotomy for the PRF is really short, only few minutes, and in those cases you can reassure the patient there is no such risk. Now that we know how to access the veins, we can also inject a product. To do so, you just need to unscrew the tube holder, fold a bit the tubing and disconnect the tube holder. It is a lower lock connection which is universal. You can now connect the syringe with the substance of your choice and slowly inject it. Let's now see one last time two full procedure of the venipuncture. The first step, I told you, is to open the bandage, fold a bit one of the lateral side and stick it on the dominant hand. I'm left-handed, so the bandage will be on my left hand. Then put the tourniquets around the patient's arm and tighten strongly. Apply alcohol and tap on the skin to heat the skin and increase the vein volume at the maximum. Now palpate inside the M to find the best vein. You can now take your pen and draw your vein guide by drawing points exactly where you feel the vein. This way you have a visual marker. You can check your guide with the vein light. After, pull the skin at 10 cm and prick with an angle of 15 degrees. Check the blood backflow and stick the bandage. Now that your venous access is secured, you can connect your tubes. Remember to hold them tightly inside the tube holder. Then remove the tourniquet. Slowly unstick the needle wings and withdraw the needle. Press on the puncture point and ask the patient to fold the arm. Another full procedure. The bandage is already on my hand. I'm putting the tourniquet and I'm pulling strongly. I apply alcohol and I tap to heat the skin. Even if the veins are easy, they will be even easier. Then palpate inside the M to choose the best vein to prick. Draw your vein guide by placing points exactly where you feel the vein. Then pull the skin of your patient at 10 cm of the puncture point and prick. Check the blood backflow and stick your bandage. Connect your tube. Remember that the filling of the tube has to be fast, between 10 to 15 seconds maximum. You don't want the blood to clot inside the tube. Remove the tourniquet and withdraw quickly the needle. Press on the puncture point and ask the patient to fold the arm.